what specific support does Cancer Tutor offer? I know that you've told us a lot of things, but is there anything else that people need to know, like maybe when they get on there, where they should go, what specific things they might be looking for?
That's a great question. As it relates to the services that we have to offer at Cancer Tutor, there's multiples. First off, we've already mentioned it's a free service. So take full advantage of it. We have recently developed a free membership portal on Cancer Tutor, making it very easy for you to archive your own researched articles or information on Cancer Tutor. This is really exciting because once you create your free membership and you have your own account, again, it's at no cost, you can begin to save your favorite articles in your membership. You can follow a doctor. You can begin to save information on a specific cancer. You can opt in for us to send you information on the specific things that you're requesting. We are not going to e-blast you with all kinds of unnecessary information. We are only going to send you what you request of us.
That's amazing. That's amazing, Robert. I mean, what a tool to actually, once you decide what you really fit into, because you know what, we all know this, okay? When somebody says to me, well, I've got this cancer and I've heard about this, and this, there's so many ways to the top of the mountain, and you know what? There's none better. Some are not better than the other, but it's what you vibrate to. It's what you are pulled to. And to actually give somebody a tool like that once they lock into something that they feel very strongly about, that will help to turn their life around, and then you've got a tool to help to support that. I've never heard of that before.
Yeah, we're excited about it. We're leveraging the technology currently to develop solutions to walk just millions of cancer patients through their healing journey from point A to point Z. So now is the time to create a free account. Take full advantage of it. It's going to continue to evolve, and it's just simply going to get better and better and better. So I really encourage everybody to do that. Obviously, there's a lot of things that we have to offer, but that's significant. And again, there's over 600 articles. There's information about clinics. We have information about how to fund your cancer treatment as well. Lots of good stuff.
And if I can say something, and I am not a person that buys into fear at all. So I'm not coming from a fearful place when I say this, but it would be really wise to start going on the website. And you know what? Do you know why you wear a seatbelt? Because there is a risk of an accident. Now, do you know why you go on Cancer Tutor even though you're healthy? And don't go there if you're going to be fearful and worry about getting cancer, because whatever you think about, you're creating. But if you're the type of person that's a Braveheart warrior and you understand that what you think you create, and you go on there and you start researching and you start compiling information, what will happen when somebody in your family ends up getting cancer? Because guess what? That's a bet you don't want to take, because 1 out of every 2 people are going to be dealing with cancer on this planet. So you might as well get over that one right now and understand that if you do your research and you become knowledgeable, you just might save a family member's life or a friend or your own. And guess what? This is a very toxic environment we live in. And you know what? They're not going to stop shoving down our throats that cancer is a life sentence and that you can't. The thing is that unless you are opting into a better lifestyle, which means that you're on Cancer Tutor and you're doing research, then how are you not going to get it? So somebody, just one person out of every family, needs to become the hero. needs to go in, and they need to go in and forge a path and get the information, so when the family, anybody in the family finds out they have cancer, and then guess what happens? They don't take action because they have no information. They react with what? They react with stress and fear, okay, because that's all that's out there. And what happens when you do that? Every time you have a negative emotion, you kick in negative chemicals, and those negative chemicals go in and create inflammation and scar tissue formation and mutation, and they blow the cancer right through the roof. So somebody in the family better be a hero to calm everybody down. Put your seatbelt on, and then you'll be there to save a real accident. Anyways,
Yeah.
Robert, take it away.
Yeah, absolutely. I just love what you just said. We have to, all of us collectively, be active. We must stay away from being passive. Passivity isn't going to help anybody. So when I invite you to become a member on Cancer Tutor, it's to take an active role. Why wouldn't you take advantage of the tool when eventually 1 out of 2 people is going to get cancer? So you can help save a life. Matter of fact, I didn't mention it, but when you save an article on your membership, you could take your own personal notes right inside the article for your own personal reference. You could follow a doctor and an author, and we'll alert you when new information comes out by that author. This is just a great opportunity to be actively involved. And that way, when one of your loved ones gets a cancer diagnosis, you're able to jump in and help them.
That's right. One
right then and
brave
there.
heart warrior, one hero. That's all we need per family. And guess what? And the thing is that the more that you become confident and really releasing the true self, because our true self doesn't live in fear. And when the fear starts, you can smell the fear in your home or in the family, or people start to cry and scream and feel the end is coming, and you can reassure them that you got this. I'll tell you something right now. What we think about, and this has already been scientifically proven, that when somebody has the belief of healing, every cell in the body picks up on that. And when somebody has the belief that it's over, that there's no hope, every cell picks up on that. And we know that. And you'll find even information on Cancer Tutor about that. So understand something. Your thoughts create things, and you can't get the right thoughts or beliefs if you're not going to take the time to do the homework. And we've got the best portal for you. So, make the first step.
Yeah, thank you. Thank you for that.
All right, so does Cancer Tutor come up against, well, they must. I don't even know why I'm asking the question, but what type of resistance do you guys actually come up against? Because for one thing, you're for free. The next thing, because you're for free, you're able to tell the truth. And sometimes the truth steps on toes. So,
yeah, the truth most definitely steps on a lot of toes. We're going to have our detractors. That's okay. I often tell folks when somebody's really barking a lot against an organization, they may come under different names like Quackwatch. That might be one of them. Maybe they are prescription drug pushers that are saying these things. You should investigate it. When somebody is speaking so harshly against an organization and they want you to stay away from them, maybe there's something there. Maybe there's more than meets the eye. Go check it out. There is a segment of the population out there, for whatever reason, that thinks that being ignorant is the way to save your life, or that it's the answer to a happy life. And nothing could be further from the truth. Ignorance is not the name of the game, so inform yourself. So sure, we have people that don't like us out there. The people that are afraid to investigate a medical journal or they're afraid that you would investigate a medical journal, they're not going to like organizations like Cancer Tutor, passive people that are unwilling to evaluate natural and integrative treatments for cancer or anything else. They're not going to like Cancer Tutor organizations like us. So finding the truth, it requires some work, but once you've found the truth, it's going to set you free. And just like a muscle, you have to exercise. You have to take an active role, or you're just going to atrophy. But it's not necessary. It's not necessary. And if you truly love your neighbor, if you have love for yourself and self-respect, you're going to take an active role to find out what is the truth about cancer or anything for that matter.
Well, I don't think it's going to be too hard to find the truth when they start searching you out. Back in 1910, the word quack actually came about when the AMA was trying to push natural health out, and the medical doctors were going around, and all there was naturopaths, homeopaths, osteopaths, and herbalists, and the general population actually gave the name to the medical system as quacks. So, and then that got switched around over the last 100 years, and now we're quacks, right? So, yeah. But the last thing I want to say is this, is that take a look at the people that usually are against Cancer Tutor, and you'll find out they have something to do with the pharmaceutical corporations or the medical system. And then take a look at the side effects of what could happen if you go with the medical system route, and then go and take a look at the side effects that could happen. And the only side effects you're going to find with Cancer Tutor is that you are going to get your courage back, and you're going to be finding natural, loving ways to honor your system. Hey, Robert?
Absolutely. Absolutely. Well said. I want to challenge everybody listening to my voice or viewing this interview that it is time for each and every one of us to do for the truth what others are willing to do for a lie. Do for the truth what others are willing to do for a lie. It will save your life. It will certainly save the lives of others. You will be a happier individual, and you will be spreading a lot of love and happiness to other people when you take that position.
Yes, thank you. And you know what? And I also want to say myself, and this is something that if you want to do the research, you'll find out it's quite true. And that is that my children's children are not supposed to outlive their parents. So understand that there is a huge crisis here. So please, you know what? The system will do everything it can to distract you from what is the most important thing in your life. And do you know what that is? First and foremost, you. Secondly is your family. And do you know what? Do you want to have a family to still love? And you might think I'm dramatic, but you don't sit where we sit, where you don't get to hear the stories we hear. Start listening to the people in your family, your relatives, your friends, and hear about how many people are actually involved with somebody that has cancer. And you'll find out that today everybody has somebody that is a friend or a family member dying of cancer right now in this very moment. So this is not to be a drama queen here. This is real. So we have to understand that if we come together, this whole thing changes. Because guess what? It's just a thought. And to do that, to change the thought, you need to erase dysfunctional beliefs. And as soon as you realize and get out of your own way and release the power within, you'll have it. So Robert, what does the future hold for Cancer Tutor?
We have all kinds of good things that are coming in the near future at Cancer Tutor. I have so much I could talk about, with you, but over the course of the next year, our team is developing software currently that learns about you, the visitor, and your unique situation in order to help bring you the right piece of content for your next step in your cancer journey. So this is very exciting. You need to think of it like Pandora. The way Pandora learns what kind of music you like to listen to, or the songs that you listen to, which songs you skip through, which ones you thumb down or you thumb up. We're basically beginning to really leverage all of the algorithms out there to do the same thing. Learn how you're interacting with Cancer Tutor's website, what articles you're reading, what emails you're opening, what doctors you're following, which articles are your favorites. And then ultimately, we're going to personalize the entire website for each individual visitor. And this is just phenomenal. It's just going to keep making things easier and easier and easier. So, as an example, let's say that a female that has breast cancer goes into Cancer Tutor and likes Dr. Jane Doe's approach and signs into Cancer Tutor. That visitor is going to get a completely different website experience on our homepage versus some other recommended article that's comparable for a male with prostate cancer who likes maybe Dr. Brown's approach to addressing cancer. So we are taking the website and fine-tuning it for a very, individual approach for the visitor. So we think that, this technology and the approach that we are developing is going to allow Cancer Tutor to be the number one cancer resource in the world. As you've mentioned, we already are, is what you're thinking, and we're always just trying to make it better. We're not satisfied. We're not passive. We're actively participating in it.
Well, this is the health revolution that will actually turn cancer back upside down. And you know what? And what this is about is you're actually creating a program that you will have your finger on the pulse of every individual's health. So, you'll be able to monitor their pulse, like monitoring what they need. It's like, here's the thing. When somebody goes out to dinner and they keep changing their mind, well, they never get their meal because they don't know what to go, they don't know how to focus, so they never get delivered the information. But by you being able to track people, you'll be able to keep them more well focused and filtering out the information they don't need so that you can deliver the key that will help to unlock the door to their health. And I think that's just totally amazing. So what else is going on?
Be on the lookout. Our editorial department has been doing some very extensive research for an upcoming article. It's a 3-part article. It's got over 32,000 words in it, and it's on the topic of food. There's all kinds of information on the internet about food. We're not taking a position that this is the best diet per se or this one over there. However, the 3-part article that we're producing is very well researched, and it's going to empower the readers of it to make, again, informed decisions as to what they should try in the area of foods, because there isn't necessarily a one-size-fits-all, but it's going to be very informative. I'm pretty excited about it. Be on the lookout. It will be coming out soon, and I think it's going to make a big splash out there with our audience. And we invite everybody to come join, be a part of it, support the work of Cancer Tutor. Let's reach more people. I also one other thing as far as the future, sometime in the future we're going to have an online coaching platform for our audience, for our members, that want to get some direct coaching from healthcare professionals on different particular topics. And we've been working on this for quite some time, and it's not gonna come out next month, but when it does, it's going to change the way that online coaching is done, and so we're excited about it.
And I have to tell you something. If I had my way, it would be out yesterday. And because here's the situation. Until a cancer patient has the perfect day, every day, then they're going to live in frustration. And the thing is when you have cancer, you don't have years to get lost in the internet maze. And if a cancer patient or any patient, let's forget about cancer for a second, let's talk about everyone. If you knew what to do the minute you woke up until you went to bed to create a heart full of love and a life full of joy, this world would change in an instant. And that is what's going to happen as soon as Cancer Tutor is able to put this huge but amazing project together to be able to facilitate and bring you a coach that will be tailored to suit your individual needs. Think about that. There's the Holy Grail right there. When you can get truthful information and you can get a blueprint to suit your lifestyle from the minute you get up until you go to bed, and you can use that each and every day to bridge the gap, to unleash the real healing within. And that's why we're doing this video series, because I believe in you.
Thank you for the opportunity, Dr. Wolfe. Your comments, your generosity towards us is much appreciated. We're humbled by it. We're going to continue to do the very best work that we can so that we can bring the best information to our visitors. And we certainly hope the very best for you and your organization. And we look forward to the next opportunity that we have together to talk about cancer.
Thank you, Robert. And I want to thank everybody for taking the time to watch this life-changing, life-saving information. And I want everyone to understand something, that, I will not just talk it, I want to walk it. And as everybody who knows me knows, is that it's all about integrity for me. And I've been dealing with people on a physical and emotional level with cancer for over a quarter of a century. Robert, again, I can't thank you enough for all the work that you do. I cannot thank Webster Keir enough, and everyone else that people don't even see behind the scenes that are bringing a revolutionary change to the way that we see cancer, the way that we deal with cancer, and the way that we feel about cancer.
Thank you, Dr. Wolfe. I really do appreciate it, and I wish you nothing but the best, and I look forward to our ongoing discussions and our future partnerships together.
Thank you. And remember that the power to heal is within inside you. It's not outside. So take a good look within and release that brave heart. And thank you for joining us for another DocStar production. And remember, CancerTutor.com is waiting for you to become a part of their family. Take care.
Thanks for watching our video.
If you enjoyed this DocStar TV production, then be sure to check out all of our amazing interviews, webinars, and trainings at DocStarTV.com. Want to be on DocStar TV? Give us a call at 1-855-900-4544 to schedule your interview today.